Hello listeners, a warm welcome to Views on Health. As always, a pleasure to have with me on the program tonight Dr. Bimantha Perera, consultant ENT surgeon at the Kothalawala Defence Hospital. We had Dr. Bimantha Perera in the recent past, and a pleasure, Doctor, to welcome you back to SLBC and the program.
Thank you.
And for the information of our listeners, the focus on the program is going to be globus and chronic cough. To enlighten you on this, over to you, Doctor.
Thank you. So, I think this is a very important topic, and you'll see why. Because I'm sure many of our listeners will be able to relate to what we are going to discuss today. So, what we use as the term globus actually means when a patient comes and complains to us very vague symptoms of foreign body sensation in the throat, frequent throat clearing. That's the classical thing they come and tell, and they say, "Oh, doctor, I think I have something stuck in my throat." Commonly they come up with stories till that, "Oh, I had a fish bone injury 6 months ago. Doctor, do you think I still have that bone in me?" This is what we call as globus. It's kind of a sensation in your throat that there is something, and the urge for you to clean it.
So, Doctor, this is very common, as you say, because I would personally say even I experience it at times. So we come across people trying to clear their throat, and they feel that there's something stuck there, and then of course when they clear their throat they're okay. And there are some who say it recurs.
Exactly.
Within a short period of time. I mean, not like a day or two later.
Yes.
So could you explain that?
Yeah. So I'll just tell some basic background in more scientific terms, because this globus also is related to a chronic cough. So that's why I would like to tell and then come to your point. So what happens is you have your larynx or your voice box, which has the 2 vocal cords surrounded by muscles. Okay, these muscles only contract to make you speak and breathe and also swallow. Okay, so that initial bit of swallowing. So what happens is there is something that causes these muscles to get tensed, and there is something that irritates this area, which leads to a very hyper irritable larynx, leading to this sort of problems and chronic cough as well. So it's a spectrum of problems. The patients initially start with telling that, "Oh, I've got something ticklish in my throat or something stuck in my throat." The next they come and tell, "Oh, we keep on clearing our throat, it's not getting better." Next stage is they said, "Oh, I think we've got changes in our voice also. I feel tired when we talk by the evening." And last but not least, they tell that we can't swallow. It's difficult to swallow as well. So, and these all can progress to a cough where they have an excessively severe cough to the extent that some people may even faint just because they have some irritation in the throat. So that's why I think it's an important thing we need to discuss, and how basically we should address this.
Thank you, Doctor, for explaining that aspect of the sensation rather that one feels in the throat, and how it's connected to a chronic cough. But is it always connected to a cough, or sometimes would it be just by itself?
No, it's not always connected to a cough. In the spectrum of the problems, cough is towards the latter part. Yes, the more severe part. So what are the things that actually cause this thing? That is what I think everyone's in the back of everyone's mind. So the first thing, I'm sure if you ask any of the patients who come to me, "Oh, doctor, is there a cancer?" That's the first thing that comes into mind, and that is aptly suitable for them to seek medical attention to make sure that they don't have that. We will just briefly tell a few things that we actually ask the patients. Do you have a difficulty in swallowing? Do you have a change of voice and a continuous hoarseness of voice for more than 3 weeks? Is there a cough? Is there any blood stain sputum? Do you have loss of weight and loss of appetite? If you have these things, yes, we will probably investigate a little more to make sure you don't actually have a cancer. Okay, but you'll see a few of these overlap. Now, the other causes are problems of your nose. Sometimes you may be having a runny nose, catarrh, which I think we discussed before, and also chronic sinusitis, which leads to something called a postnasal drip. Again, a very frequent complaint. People say, oh, I feel something coming down my nose, down to the throat and irritating. Exactly right. So that is also another cause for the globus sensation. But quite often we may not actually see anything, but it's just the sensation that the patient is actually having. However, we need to look into these matters as well. And then obviously problems in the lung can cause cough, and that can irritate the throat as well. So one should not underestimate that. And the other most important thing and most neglected part is silent reflux and gastritis, which many of us take it for granted.
Could you explain that, Doctor? Silent reflux.
Yes. So what now in scientific terms, I'll try to make it very simple because I'm sure everyone knows of gastritis. So what is gastritis? Oh, it's that heartburn. It's the burning sensation that comes up to your throat, which is not very pleasant. But not all of us have that. However, many of us may have a silent reflux. That's basically your stomach produces acid. So if there's anything that produces more acid, it can reflux. There are other causes as well, but I'm just telling for everyone to understand. But apart from that, you also have something called pepsin that is produced in your stomach, which if it's produced in excess and it comes up, you really don't feel anything. However, when it comes up, it kind of irritates the throat on top, and it actually possibly produces a little mucus. This is what the patient feels, and this is what they try to clear. The problem is, each time they try to clear, the vocal cords hit each other. The vocal cords hit each other, the muscles tense around it. Each time this happens, obviously the larynx tends to get more hypersensitive. And over time, months to years, if you keep on doing this, which I'm sure most of our listeners must be now relating to themselves as well, even a tiny bit of mucus can trigger a cough or a sensation of choking. This is another common complaint. So the problem is each time you clear your throat, you actually irritate it more, and there is more mucus, and it gets dry, and that is just a vicious cycle. That is where the problem is.
So what would you recommend?
Yes, so that exactly comes to our management part of it. So first of all, obviously, yes, if you have any doubt, it's best to seek medical advice. See your GP, or if they prefer, show an ENT surgeon who could actually examine your throat and nose, because as I told, there are causes of the nose as well. If you do have a chronic cough, you definitely need to get a respiratory physician's opinion, and they will be able to tell that, okay, the lungs are clear, it's probably somewhere in the throat. Then we are there to help you as ENTs. After we examine, we basically evaluate you with a small nasal endoscopy to see the movement of the vocal cords, to see the movement of the muscles. We tell you to speak, sometimes we tell you to sing, we tell you to make noises, and we can judge the movement of all these parts in your larynx. And then we will advise you on how to manage this. So the first few things are actually conservative management. What do you mean by conservative management? Basically, a good night's sleep, stress-free life, and good habits in eating, especially reduction of your tea and coffee, reduction of chilies, reduction of oil and spicy food, and also flour. Eating more healthy food. These are the basic crux of it. Why? They actually reduce the secretion of pepsin and hence reduce the irritation on top as well. Obviously, if you have a nasal problem, you have to treat that. And we would probably give you some nasal drops, nasal washes and nasal douches if required. If you do have a problem with your voice and if you actually have a tight sensation in your throat, what we do is, as we examine, we check what sort of muscle tension is there, and then we can diagnose something called muscle tension dysphonia. That's where we actually refer you to even to a speech therapist who can actually teach you few techniques, few exercises in order to help you with all these things. But the most important thing is actually not putting your phlegm out. That means not doing this is the singular most important thing. It's easier said than done, unfortunately. If you try not to clear your throat, you will find it almost impossible. So what I do tell is very practical thing. Keep a bottle with you all the time. And when you feel that ticklish sensation in your throat, have a sip of water. It's not magic. It's a simple solution just to wash away that irritating mucus so that you will not clear the throat. Or you will not cough because there is no stimulation there. Yes, if these fail, we do have medication, and in extreme cases we do have other interventions as well, but very, very rarely do we need to do them.
A question on taking a sip of water to get over the irritation, but then what they feel is that there's something stuck there and it's actually some sort of mucus, and then if you take a sip of water in that situation and you expect that to go down. So for the information of our listeners, doctor, could you explain that mucus going into the system, will it have any adverse effect? They might want to know.
Yes. Mucus is an absolutely normal thing and you should have a good amount of mucus. In fact, we swallow, unintentionally 1 to 1.5 liters of saliva and mucus every day. So it's absolutely normal and it's safe to swallow your own mucus. Keep everything what's produced inside you. Do not try to put it out from your mouth. That's the key message I can give today.
That does make sense. It's in your system.
Yes.
And you advise that can remain in your system. It goes down, of
yes.
course, into your gullet.
Yes.
And then it wherever it's there. So, but it's not going to adversely affect anybody.
No, it won't.
That is what is
yes.
important, because
I suppose it's a more cultural. I suppose it's also a more cultural thing for us to put it out.
Well, I guess so, doctor. But then you have to go into the washroom to do it. You just can't do it wherever you are.
Yes.
Unless it's such a situation where you just have no access.
Exactly.
So interesting, doctor. So now you spoke of managing it. You said conservative first. But then you obviously go into other modes of treatment.
Yes. So we do have some medication, especially if you have the chronic spasmodic coughs. We do have certain medications which would be prescribed by the ENT surgeon or the respiratory physician. And do not forget, especially if you have a cough, you do need to go to a respiratory physician or your general physician who needs to make sure you don't have any other chronic problem in your lungs, because don't forget, the mucus from the lungs also come and irritate this throat. So it's a balance of everything that we have to, it's not a single man's work. It's a multidisciplinary approach we have to take here.
Will this situation, the conservative management or through medication, help a person who has this condition to overcome it?
Very much. We are seeing very, very good results with patients who are having there good amount of water and taking adequate lifestyle changes, and the speech therapy actually really does help. It's nothing much, but it's a few exercises to relieve the muscle tension around your larynx, which especially for people who talk and for singers, it's a really, really important thing, I think.
Doctor, focusing on water,
yes,
it should be room temperature?
Good question.
Some people just want iced water. They cannot have anything other than iced water. It's just a habit. Otherwise, warm water, hot water.
Yes. So on the contrary, most of the patients come to us and ask, we have hot water, doctor. We have no problem. We have hot boiling water when this happens. I tell otherwise, because hot boiling water, again, is an irritant to your throat. Why burn it? Yes, lukewarm water is absolutely fine, but normal water, absolutely fine. There is no real scientific evidence to show that the cold water is bad, but logically hot water does cause problems. But warm water, lukewarm water is absolutely fine. I probably personally prefer that on a personal note.
Thank you, that's interesting. Will this condition lead to any other problem in the system if neglected? Yes.
So it can lead to spasmodic cough or a neuropathic cough, which is a quite a debilitating condition where the patient coughs and coughs and coughs and coughs. Some patients even may pass urine while coughing, which is extremely embarrassing in a situation, or they might even fall unconscious, and it's just purely due to the choking sensation. But hopefully none of them are life-threatening.
That's good to know.
Yes.
Doctor, is this condition evident, or it just starts from childhood, or in adolescence, or in young adults, older people?
Yes. So we do see it in children rarely, adolescents as well, but predominantly the older generation.
Age-wise?
It varies. It can be from anywhere, and that's where I'm going to come next, because there is one other factor that we don't consider too much, and it's kind of taboo to speak about also. That is stress. So
why taboo?
Because people do not like to associate sometimes that, this is due to my stress. But when you keep on asking, then they open up and they say, yes, I actually do have a stressful condition. But quite often, people come to us with this problem because they've had a family member who had a cancer. And in their hearts, they're worried. So it's that little element that really prompts them to come. But not only mental stress, it's a physical stress as well. So the pepsin in your stomach gets produced if you are physically stressed as well. So people who are on polypharmacy or many drugs, or they're having chronic ailments, they also may be prone for this. And we do advise them on how to manage with medication, how to swallow and do all those things.
Would at any stage, would one feel nauseous?
I have come across a few patients like that, but I wouldn't say that is always very common. Yeah.
Thank you, doctor. So we have globus and the chronic cough, and it can be addressed.
Yes. So
at what point do you think someone must seek medical attention so that they don't come rather late in the day?
So first of all, as I told you, if you do have hoarseness of voice for more than 3 weeks, that is a definite indication where you should seek medical advice. If there is any unexplained weight loss and loss of appetite, if you are having a chronic cough more than 8 weeks, okay, but I wouldn't, so by definition they say 8 weeks, but I probably wouldn't wait for 8 weeks to seek medical attention. But if it is not responding, then you definitely need to get help from a specialist. These are the most important things, especially a hoarseness of voice, because if you do have a hoarseness of voice for more than 3 weeks, we need to check if there is an early cancer or any lesion there.
Because initially when there is some sort of hoarseness, the tendency is to gargle with warm salty water or take some hot liquids on a regular basis, hoping it'll ease.
Clear up, yes.
But you would say that if you take after about 3 weeks, one has to sit up and take notice.
Yes, especially if it's continuous. That means there is something wrong with your vocal cord. It may be something else, it may be totally benign, but we do need to address it.
Thank you, Doctor. So time has caught up with us. What would be your take-home message?
Yes. Try not to clear your throat. Do not be worried, but do take your health into concern, and a good balanced lifestyle will help prevent a lot of problems.
Thank you, Doctor. And there we end this interesting discussion on globus and chronic cough. To you, Dr. Bimantha Perera, consultant ENT surgeon at the Kotalawala Defense Hospital, we say thank you very sincerely. Thank you so much for being with us. And we hope you can come back in the near future to focus on other important aspects in your field of specialty. Thank you too to Piumi Idrisinga for technical assistance, and Fatima Razikada saying good night and looking forward to your company next Monday same time on Views on Health.